next slide. So some positive feedback loops. The pain can cause stress. You know, if you can't deal with if you can't cope with the pain, it's not ending, it's going to be stressful. And when you're more stressful, your muscles tighten. And guess what? That causes more pain. Another feedback loop at the same time. All these things are going on at the same time. Pain can cause you to not sleep so well, lack of sleep. When you don't sleep so well, the tissues don't heal. And guess what? You cause more pain. When there's unrelenting pain, of course you're going to get depressed because it's not fun to have pain. And guess what? That causes more pain. There's actually the same place in the brain that registers depression, registers chronic pain, which is one of the reasons that they do prescribe antidepressants often when a person is in chronic pain. Pain also can cause anxiety. What's going on with me? One of the classes I teach now is a pathology class, and I had this issue when I was a student of pathology, but whenever I teach a different pathology, I start thinking I've got whatever that is. And when I have a pain that I can't explain, I go to the worst case scenario. Oh my goodness, when I had a lot of clients who had, well, not a lot, when I had some clients who had ALS, that was my description. Oh my goodness, I've got pain. I bet this is the beginning of ALS. When I've had patients with cancer, it goes to the worst catastrophic scenario. That anxiety is rough. Little clip at the end. Some other contributing factors that cause that cascade of symptoms and discomfort, like I said, anxiety, having an undetermined cause often makes you think of the worst case scenario, and that causes more pain. These are things that we have a lot of control over as therapists. Disappointment in promised and failed miracle cures. So it is really not at all helpful to your clients to say, you know, I'm going to take care of all of that when you can't, if you can't. Much more helpful to say, let me show you, let's take a baseline measurement of your pain and how much you can do right now, and then see where you are after the session to see, oh my goodness, there's a shift, so that they can see that there's been progress. Seeing that progress is something that will counteract the pain, that they see that there is something they can do about the pain, which we'll get into even more when we talk about meaning and pain. But promising the moon and not delivering will cause depression, which will cause even more pain. And some of those medications I talked about, the opioids, they can cause side effects that cause even more pain. Other life factors that contribute to chronic pain: worries about your job. You know, I can't cope. I'm not going to be able to do my work. How am I going to support my family? And that ties in with how am I going to support with my family? I'm not pulling my weight. I'm not doing the chores. I am irritable with the people who support me the most. How's that working out? We talked about health worries before. What's wrong with me? That can cause more pain. Sexuality. You may not feel very much about feeling sexual with another person. It may hurt. And then that's a source of joy that's actually causing more stress and more chronic pain. The doctor and hospital visits themselves can cause more pain, or especially you have 15 minutes in the Americas, or in the United States. It's typical visit you have with the doctor is 15 minutes, and hardly enough to even get all of your symptoms down. Usually the quickest thing is just to prescribe some medication or some procedure without really listening to what's going on with the client. That dismissal can cause more pain. And then some of those procedures or medications, like I said, that facet nerve block actually caused me more pain. I had some experiences with herbalists who were experts in their field that caused me to dehydrate. I had to go to the hospital, caused me more pain. Medications, we talked about the opioids somewhat, but that also can happen with the antidepressants. Antidepressants work for a while, and often they'll just quit. That can cause anxiety and more pain. Talked about anxiety and depression themselves. And then just lack of positive experiences.